Today we're going to talk about adolescent pregnancy. Adolescent pregnancy, a result of multiple factors beyond just the obvious lack of timely birth control. The teenage birth rate in the United States across racial and ethnic groups declined continuously between 1991 and 2005. Although it increased a little bit between 2005 and 2007, it decreased to really low levels, historic low levels, between 2007 and 2019, largely related to increased contraceptive use and increased use of highly effective methods of contraception. Unfortunately, racial disparities related to social determinants of health, for example, how access to health care is available, continue to be an important issue as the birth rate in Hispanic teens and non-Hispanic Black teens was approximately twice that of non-Hispanic white teens. The birth rate in American Indian and Alaska Native teens was approximately 2.5 times that in non-Hispanic white teens. Mental health disorders like major depression, bipolar disorder, or psychotic disorders appear to also be an important risk of pregnancy among teenagers. Approximately 19% of women aged 15 to 19 who have sexual intercourse become pregnant. Many pregnancies among teenagers are unintended. About 50% of those who get pregnant did not use any method of contraception before the pregnancy. 24% because the partner did not want them to use contraception, which is a concern. 31% believe they could not get pregnant at the time, which is also concerning. And 13% actually had trouble trying to get contraception. And very interestingly, 22% actually did not mind getting pregnant. An important factor in adolescent pregnancy is the age gap with respect to the partner. Approximately 1 in 5 infants born to adolescents were fathered by men 5 or more years older than the mother. Interestingly, some adolescents perceive positive consequences of pregnancy or childbearing and actually want to be pregnant. In a national survey, nearly 1/5 of the girls responded that they wanted to get pregnant, and another 1/5 that they didn't mind being pregnant. Other adolescents may feel stigmatized by the pregnancy, and this is associated with multiple factors, including white race, ethnicity, not being in a legal common law relationship or engaged to the baby's father, having feelings of isolation, aspirations to complete college, experiencing verbal abuse or being fearful of being hurt by other teenagers, and experiencing family criticism. Very sadly, suicidal ideations happen in 5 to 14% of women during pregnancy, in adolescence, and the postpartum period. And teenagers are at a greater risk than older women to complete suicide. Although in many cases, adolescent pregnant women can endure and go through the pregnancy, there are increased difficulties and complications that may arise for them. Some go on to carry their pregnancies while others will not. Approximately 25% of pregnancies in adolescents, less than 20 years of age in the United States, are terminated electively. 15% result in miscarriages, and actually 61% result in a birth. The pregnancy termination rate among adolescents is lower than observed in 1990, when it was about 34%, and represents approximately 1/5 of all abortions performed in the United States. Adolescents are at an increased risk for adverse pregnancy outcomes, such as preeclampsia, which is elevated blood pressure in the pregnancy, preterm birth, and fetal growth restriction, which is an unusual slow growth of the baby, and later on, infant deaths. Postpartum depression is a very concerning issue as adolescent mothers are at risk. Reported rates of postpartum depression in adolescents range from 7 to 37%. This is mostly increased during the first 3 months after delivery, which is very concerning too. Adolescent parenthood is challenging, and it does not refer only to the female teenager who bears the child. Family and social support are crucial to reducing the adverse social and financial outcomes associated with adolescent parenthood. For the mothers, they're less likely to receive a high school diploma. Although 7 out of 10 adolescent mothers complete high school, they're less likely than women who delay childbearing to go on to college and have additional education. Mothers are more likely to live in poverty and receive public assistance for long periods. And they are also at risk for intimate partner violence. On the side of the adolescent father, they tend to finish fewer years of schooling than older fathers. They're more likely to earn less income and they're less likely to have a job. But there are also consequences for the child, as children born to adolescent parents are more likely to have health and cognitive disorders. They're more likely to have poor academic performance and repeat a grade or drop out of high school later on in life. And they're more likely to be neglected or abused. In fact, also, female children are more likely to have an adolescent pregnancy in the future, and males seem to have a higher rate of incarceration. So preventing adolescent pregnancy requires not only successful programs at the school and community levels, it is also important that parents understand that it is important and necessary to implement a combination of interventions that provide clear and thorough sexual education, not only focusing on delaying sexual activity in young teens, but also promoting the consistent and correct use of effective birth control. We, as parents, have a big responsibility trying to minimize the risk of adolescent pregnancy for our children. Let's understand that these conversations need to happen and should not be avoided. About the issue of adolescent pregnancy in the United States, let's remember this. There are racial disparities that need to be addressed. Up to 19% of adolescent women become pregnant. Adolescent pregnancies have an increased risk of adverse outcomes. Suicidal ideation can be sadly present in up to 14% of adolescent pregnant patients. And finally, adolescent pregnancy affects the mother, the father, and the child.